I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
One of the study panel's recommendations is that we do more research on the long-term outcome of patients who have been treated with ECT. And I spoke with Dr. Goodwin, the scientific director at NIMH, and he's told me that he would like to see data available about the medium-term and the long-term effects of ECT, whether it reduces recurrences in patients and whether it has any long-term advantages. And he is of the opinion, as he told me, that the reason this research has never been done is because ECT evolved in the era before controlled studies were being widely done, and it predated the research era. Is that your interpretation of why such research hasn't been done yet?
I think that's a very important factor. I think there's some other factors. If we look at the VERSE study, what they have done in some of the very best studies where they compare ECT with sham ECT, which is everything but the actual administration of the current, that the ethical constraints that are imposed and should be imposed require that individuals cannot be placed in a no-treatment situation for more than 4 week period of time if they're seriously ill enough to be considered as candidates for ECT. So consequently, those studies did follow people for 4 months, for 4 weeks, and showed benefit of ECT. The situation becomes complicated after that because those who had the sham treatment and the real treatment both had access following the 4 weeks to other treatments because of ethical and considerations. So the long-term effect is unclear. However, I think it's also fair to say that in the period of time following the 4 weeks of treatment, most of the patients remain without a relapse, although many of them were on other medications.
Dr. Stone.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope and you might make copies available for the panel. We're talking about having at least accurate information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. I've also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding like the truth in lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure factual data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gum.
Huh?
Out with your gum.
Okay, this won't hurt. It'll be over in just a moment.
Uh-huh. What's that?
Conductant.
Oh, dabble, do you? Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Oil?
Now just bite down on it. That's right. Just bite down.
Huh?
Now bite down on it.
Good. Are you ready?
Ready.